Those of you who are in California, I'm also really sorry for having to learn all the. Okay, so navigating California's reopening. So for those of you who don't know me, my name is Melissa Tompkins. I am a certified veterinary practice manager. I'm also an HR professional for the state of California, and I am a certified compassion fatigue professional. I've been in this field for over 18 years now, and I honestly can't imagine doing anything else. I am the owner of South Coast Veterinary Management Solutions, which is my own consulting company where I get to help a lot of hospitals with problems and concerns and things that they're dealing with. So that's a little bit about me. For those of you who don't know me, for those of you who do, you know a lot more secrets. So, all right. I do have my introductory slide, which thank you to Rhonda Bell, who helped me pretty much wrote this little disclaimer. So for those of you who can't read it, I'm going to go ahead and read it to you. So this is my disclaimer for today. The information presented in this webinar is gathered from a variety of sources, all of which I have cited. Please refer to these sources when making changes and decisions for your practice. My intent with this webinar is to inform you of the changes and the resources available to you at this time to the best of my ability. Any opinions shared within this presentation are mine or the views of others and are not to be construed as legal advice. I'm not a lawyer. If you have any legal questions, please seek the advice of an attorney. So there we go. That's the legal disclaimer. It's at the bottom of the screen on the TV ads from years ago. Okay, so what are we going to talk about today? We have three main topics that we're going to discuss. I'm going to talk to you about what the state of California told us when they came out with their California Department of Public Health's public health order effective on June 15th. I'm also going to talk to you about Cal OSHA's revisions to their emergency temporary standards, also known as ETS, in case you didn't know. They were effective on June 17th. And the last thing we're going to talk about is what our veterinary hospitals doing. So we've got a lot of stuff in here. This is probably one of the most data heavy presentations I've ever done. I don't think I've ever had a presentation with so many words on the slides. So I'm sorry if it gets a little overwhelming for anyone. I wanted to bring to you guys what the state was truly saying to us. So most of the information I copied and pasted from the state's websites. So information for everyone. You're going to use the chat features to ask questions. At the end of the topic, we're going to answer questions about that specific topic. So when we get to the end of talking about California Public Health Department changes, then you guys, obviously answer some questions about that. The same with Cal OSHA and the same when we get to the veterinary topics. But we will have a different way of also being able to see the veterinary information, because I'm going to use something called Mentimeter, which is basically a digital platform that allows you to respond to my questions through your cell phone or through your computer, and it shows up on the screen that you guys will be able to see it. I get a PDF of everyone's responses, so I'm going to send that to you guys as well. So you're going to get a lot of stuff emailed to you after the presentation, and including the website links. I'm also going to be uploading this presentation to my YouTube channel, which is South Coast Veterinary Management Solutions. So if you have to leave early and you don't get the whole seminar or webinar today, you can go back and watch it at a different time, and I'll send that information to you in my email as well. And lastly, I did not look up every individual county and city public health departments when I did this, because there's a lot in the state of California, and a lot of the things that your public health department is saying will coincide with the state, but it's really important that you know if your local public health department is saying anything different. I did find something on LA County's public health department that they sent. I'm trying to get a clarification on. So I don't know how that applies to us yet. So I'm not going to talk about the city, county, and local public health. I'm only going to talk about California Public Health and Cal OSHA. So just to clarify that. Okay. So what I thought would be fun is this man, Dr. Tomas Aragon, is the Chief Medical Officer for the Public Health Department for the state of California. He's the guy that has been probably a little overwhelmed over the past year and a half, I would guess, in dealing with all things pandemic related. So he is the person who came out with the information and the guidelines that we're going to follow from the state of California. So this is basically copied and pasted from the CDPH website, which I'll send you guys the links for that. So I'm just going to go ahead and summarize what these few paragraphs say. So in the first paragraph, he addresses that there are different requirements for the use of the guidance and use of face coverings. He also talks about the guidance for big mega events. I'm not going to talk about the mega events in this presentation because it doesn't apply to us. Mega events are for over 5,000 people, which we do not have that, so I'm not going to talk about them. But if you're someone who likes to attend concerts and large sporting events or large arenas and things, I definitely would look into what that rule is so that you're kind of prepared. So the third thing that he talks about is the guidance for schools. So pretty much preschool through 12th grade and what requirements and guidance they're going to have, because that is different than the general public or the general businesses. I'm not going to talk about that either, since it obviously doesn't apply to us unless you have kids. It may apply to your children, but we're not going to talk about it here. So the last paragraph in the information that we got, I highlighted just so that you guys would be aware. So when this new guidance came out, only the first section regarding the face coverings, the second section regarding the mega events, and the third section regarding the schooling are mandatory. Everything else that public health, California public health comes out with is not a mandatory guidance. So I just wanted to point that out to you because there may be things that are recommendations, things you can do, but they're not things you have to do unless it's within the topics of the masks, the mega event, and the schooling. Okay, so what does some of this look like, right? So I copied and pasted this again from the CDPH website, and I highlighted the two things that would apply to us, because obviously the mega event doesn't. There is no more restrictions on capacity limitations. And so from the California Department of Public Health, what that means is there is no maximum occupancy outside of what the building allows. So if the building allows 200 people, then the business can have 200 people. There is no COVID restrictions on their capacity, because I know we dealt with that a lot. Restaurants could only have 20% or 30% or whatever the color tier that your city or area was in at that time. That is no longer a requirement from the state of California, from the Public Health Department, state of California. And there is also no more requirement to physical distance or social distance for customers, guests, attendees if it's an event. So I want to really clarify that with you guys. This section is specific to what the California Public Health Department is saying. So the California Public Health is not OSHA. So they're not regulating employees, they're regulating consumers. They're regulating, your clients or you when you go into the grocery store. Those regulations apply to people that are not working at that location, okay? So I just want to clarify that so everybody understands. And if you have any questions regarding these things, you can go ahead and put it in the chat. And when we get to the question section on that, we'll be able to answer those things. But I just want to clarify, so there is no physical distancing requirements from the state of California, from the Public Health Department for your business or wherever you go. Now, I have been in several businesses and people kind of naturally social distance because they're used to it, but there is no actual legal requirement to do so from the CDPH. Okay, so one of the big things is the mask. And the CDPH was effective on June 15th. And so the guidance that they've given us is that masks are not required for fully vaccinated individuals, except in some specific situations, which I'm going to talk about in a second. But I do want to clarify that everybody understands what fully vaccinated is. I'm assuming since we're in medicine that we probably all know what it is, but just in case. So a fully vaccinated individual is someone who has had their second booster of either the Moderna or the Pfizer, and it's been at least 14 days since they had that second booster, or if they had the Johnson & Johnson's booster, then it's been 14 days since that one shot that they got. So that's kind of the requirement to be considered fully vaccinated. So if it's only been 5 days since your second vaccine, or you have a second vaccine when it's required, you're not considered fully vaccinated. So just to clarify that with you guys. So the exceptions to the mask rule, if you're vaccinated, it doesn't matter if you're vaccinated or not vaccinated in these situations. So on public transit. So and I'll give the examples: airplanes, ships, ferries, trains, subways, buses, taxis, ride shares. I took an Uber last weekend. Uber is considered a ride share, so we had to wear a mask in the Uber. So it is still required for those public transit situations. It's also required for the hubs of the public transit. So of like the airport or the terminal for the bus station or wherever people gather to take public transportation. So it is required in those areas as well. And then also we talked about schools have their own requirements. It is required in schools for students and for people who work within the school. And like I said, I'm not going to talk about that guidance because it's its own thing. But if you have kids, you'll probably be told what it is. The second or the third thing is healthcare settings. So healthcare, like if you go to your dentist or your optometrist or your ophthalmologist or your MD or wherever, if you go into a hospital, you're going to still have to wear your mask within there. The highlighted version right here is not copied and pasted from the CDPH. It is me. I added this because I wanted to make sure that everybody understands that veterinarians and veterinary professionals are no longer considered healthcare workers in regards to COVID-19. We had an exception for a period of time. We're no longer within that. So we do not follow the healthcare guidelines for COVID-19 for healthcare workers for veterinary hospitals. We follow the regular business guidelines. There was some miscommunication, misunderstanding about that last week. We were told one thing on a webinar that wasn't correct, but it has been verified and we are no longer considered healthcare workers. So I really want to make sure everybody understands that. And this would be from LA County Public Health. I also have a thing from the CVMA, and then there's something else from the CDC. So it's on several different places. I think it was also in the news or something as well, but I didn't see that. The other type places that's an exception for wearing or being required to wear a mask regardless of vaccine status is correctional facilities, homeless shelters, and those kinds of things. All right, so the guidance for unvaccinated individuals. Additionally, masks are required for unvaccinated individuals anytime they're indoors inside a business. And they give some examples: retail stores, theaters, entertainment, grocery stores, those kinds of things. So if they're outside, it is not required within the exceptions of the things we already talked about. If you're outdoors, it is no longer required for anyone, regardless of vaccine status, to wear a mask, but it is required indoor businesses for people who are not vaccinated. And I'm sure a lot of you kind of know. And again, this information is simply copied and pasted from the CDPH, so you can double check me. All right, so there are some exemptions for mask requirements, and this has been here, I think most of the time that we've had COVID, that they've had exemptions, that if you're under 2, you guys probably heard this when you go to the grocery store, if you have a kid under 2, they don't have to wear the mask. If you have a medical condition that would prevent you from wearing the mask, if you're hearing impaired, sometimes that can be an issue for you. If you work in a job where it's risky to have the mask. So those are the exceptions. Those didn't change. They pretty much stayed the same from when they were originally created. Okay, so this is kind of the big one. So the guidance for businesses, venue operators or hosts, and we're the businesses, right? Because we're no longer considered healthcare when it comes to COVID restrictions or COVID rules. So I'm gonna just read it to you. In settings where masks are required only for unvaccinated individuals, businesses, and venue operators, they can choose to provide information to all patrons, guests, and attendees regarding vaccine requirements and allow vaccinated individuals to self-attest that they are in compliance prior to entry. Businesses can also implement a vaccine verification to determine whether individuals are required to wear the mask. Thirdly, businesses can still require patrons to wear a mask. And when I read these 3 sentences, I want to clarify, these are not required. If you look in this top section right here, I'm kind of arrowing it, it says may choose to. So you may choose to do any one of these 3 things, but you're not required to do so. So I just want to really clarify that with you guys, that the public health is not a requirement, it's a may. Most places are doing some version of this, and I think it's not bad. Personally, I think it's not bad to do some version of this, but it's not required of you, okay? Now, the last sentence is something that's repeated a few different times for Cal OSHA as well as public health, that no person can be prevented from wearing a mask as a condition of participation in an activity or entry into a business. So you're not allowed to tell a client that they can't come in if they're wearing a mask. You're not allowed to tell your employees that either. And we're going to talk about that in just a moment. But I really wanted to clarify that with you. I don't think we're probably going to do that, but you're not allowed to even if you wanted to. So again, the guidance for businesses, you can provide them all the information of what the rule is and allow them to, on your honor, kind of be on their honor system. You can implement a way of verifying their vaccine status, and you can also require them to wear masks. Those are the 3 different things that you can choose to do. Now, I did get this, I was able to get this image from one of the news articles because I've seen quite a few news articles that have talked about what the restrictions are and what restrictions have been lifted. And so this is something that was on Fox News that said bars and restaurants can open to full capacity, social distancing rules have been lifted, and fully vaccinated customers can stop wearing masks in most situations. So this is what a lot of our clients are being told because they're watching the news probably. So I just wanted you guys to kind of be aware of what information is there if you haven't seen it already. So what are California's businesses doing? We're going to talk about what our veterinary hospital is doing towards the end of this presentation. So initially, I took a couple pictures. So the picture on the left is Ralph's, and it's a Ralph's in Orange County that I actually on the 15th, I went there on the 15th, the day we opened, and I took the picture of this sign. So it just says masks are required for masks are not required for fully vaccinated individuals. And when I went in the store that day, because it was on the 15th, I think there was I saw probably only 5 or 6 people who were not wearing a mask. I don't know if people noticed the sign or if they weren't comfortable, I'm not sure, but there was a very small percentage of people who were actually not wearing their mask. I think that will change as we go along, but it was something that Ralph's put on their front door, and they did not ask. They did not ask anybody their vaccine status. Now, the second sign was from Petco when I was in Petco on Saturday, and Petco has a slightly different version of the sign where it says, following guidance from the CDC, fully vaccinated guests may shop without a facial covering if desired. And I would say probably a good percentage still had facial coverings on when I went into Petco the other day. So those are some examples of what some businesses have done to their patrons and consumers coming in. So it's something to think about for you in your hospital when we get there. Okay, so are there any questions about what I've gone over so far? Linda, was there anything in the chat, people having questions for me?
There are no questions right now, Melissa.
All right, go for it. If I see someone's going to be admitted. You got them?
Mm-hmm.
Okay, perfect, thank you. So, all right, we're going to go ahead and move on to Cal OSHA. So Cal OSHA is so fun. I'm so excited about Cal OSHA. Let me just tell you. All right, so okay. I got muted. Sorry about that, guys. So Cal OSHA, their changes were effective on the 17th, so last Thursday. And if you heard any changes from Cal OSHA over the past couple of weeks before the 17th, there was a lot of miscommunication of what they were going to do, and they made some rules and then they took the rules back. So pretty much only the rules that were put out on the 17th is what you need to pay attention to. And the rules that were talked about at the beginning of June, they just don't exist pretty much. So if you remember those, just throw them out your head because they don't apply. So the changes were signed in by the governor on the 17th, and they were effective on the 17th, actually. There was no delay because they originally said there would be a delay of like 10 days or something. There was no delay. So essentially the Cal OSHA rules on the 17th were effective on the 17th, okay? So I'm just going to kind of summarize, but read it to you. So this is from the Cal OSHA website, which again, I'm going to send everyone the links that I've used. For those of you who missed my beginning slide, please put any questions that you have in the chat. I'm going to email all of you the links that I use so that you can access and read those as well. I'm only talking about the state of California with their public health or Cal OSHA. I'm not talking about specific county public health departments. So if any of you that just signed on have a different, or probably you should check with what your public health department is doing to make sure it's not different. LA County has a couple differences that I saw that I'm trying to verify. So I want to make sure that everybody knows to do that on their own. And I will email all of this information for you. Okay, so this is regarding employees. We're talking now about your employees, not your consumers. And we're talking, this first section is about if people have symptoms or are near someone who has a case of COVID. So fully vaccinated employees without symptoms do not need to be tested or quarantined after close contacts with COVID-19 cases unless they are showing symptoms. So they don't have to quarantine unless they're showing symptoms of COVID, regardless of if they were in close contact or not. It doesn't matter who they were in contact with. They do not have to quarantine if they're fully vaccinated. Unvaccinated workers, the same rule from before applies as far as the quarantine requirements. Now, no face covering requirements are outdoors. So if you have outdoor play yard, things like that, those are the times when it might affect you or apply to you. The only time that it would be required for outdoors is if you have an outbreak. We're going to talk more about outbreaks in just a moment. And this is regardless of vaccine status. So unvaccinated or vaccinated, it doesn't matter. Even though though workers must be trained on kind of the recommendation for outdoor use of face coverings and social distancing that they might want to do if they're outside in a business. We're going to talk a little bit more about that as well. All right, so the highlighted section is employers may allow fully vaccinated employees not to wear face covering indoors, but they must document their vaccine status. So this is really important. If you decide to not require your employees to wear masks if they say they're vaccinated, you need to follow, or you need to document that. And I'll give you some guidance of how to do that in just a little bit, because it is required that you document it. And there's obviously some settings where the CDPH talked about it being required. We already talked about that. So kind of in the public transit, in schools, in healthcare facilities, which for those of you who missed my statement, veterinary professionals and veterinarians are no longer considered healthcare workers when it comes to the COVID restrictions. We are now in the category of regular businesses. This is from LA County Public Health, the CDC, as well as the CVMA. So just to clarify with you. If we have outbreaks, we're going to talk about in just a moment. And then it says employers must provide unvaccinated employees with approved respirators for voluntary use when they're working indoors or in a vehicle. I don't know that most of us probably have vehicles for our team, but just in case. So you're aware of this. This is a difference than we've had before, a specific difference. So I want to make sure everybody understands that. And we're going to go over in detail what that means to be required to provide respirators to your team. And the last thing is you cannot retaliate against your employees if they want to still wear their face covering, because I think a lot of people will still want to, even if you allow them not to. So you cannot retaliate against them for that. All right. Oh, what's going on? Okay. So I highlighted this so that you guys would understand. There is no more physical distancing or barrier requirements, regardless of your employee vaccine status, within the following exceptions, okay? So the exception is if you have an outbreak, which is 3 or more cases, you have to evaluate whether or not you might need some barriers. So, maybe keeping people apart or put plexiglass in between their workstations or something like that. So if you have an outbreak of 3 or more employees who contract COVID from work, that's what an outbreak is, you need to consider whether or not those things are required. Now, in the second sentence, if you have a major outbreak, which is 20 or more employees that have contracted COVID from the workplace or been exposed to COVID at the workplace, that you would have to implement physical distancing, so social distancing or barriers during a major outbreak. Now, one thing that wasn't addressed on any of the reading materials that I saw was veterinary professionals in the social distancing that we kind of had some exceptions on, because how do you social distance between 2 people trying to take x-rays on an animal, right? I couldn't find any specific information on that, so I don't know on that one. But if you have a major outbreak, you are required to implement social distancing and physical barriers. Hopefully no one has a major outbreak at this point. I mean, 20 or more people is a lot of people to get sick with it. So hopefully, knock on wood, cross our fingers, those days are behind us, but it is something to consider. But that first sentence tells you that you're not required to social distance or have barriers regardless of the vaccine status. And we're gonna go over some exceptions to that in just a moment, because of course, there's always a requirement and then there's always an exception, which is fun. So we're not going to talk about the employer provided housing. I don't think you have that. And that's next to section. Now the last sentence talks about ventilation. And this is really important. If you did not do this earlier this year or last year, you must evaluate your ventilation systems to maximize outdoor air and increase filtration's efficiency, and evaluate the use of additional air cleaning systems. We're going to talk about that in more detail in just a little bit, but I do want to point that out. If you already did that earlier this year or last year, you probably are compliant. But if you never did that as part of a COVID requirement, especially from Cal OSHA, you're going to need to do this now. Okay, so there are some rules from Cal OSHA that stayed the same from November. So for those of you who remember the November changes, there's some rules that stayed the same. You need to have an effective written COVID-19 prevention program, and that doesn't matter how many employees you have. It's not like some of the things if you don't have this many or whatever. Every business needs to have an effective written COVID-19 prevention program. If you already wrote it up earlier this year or last year, you might be able to do a quick amendment to it for any changes that you've done over the past month or weeks or whatever. If you did not do it, guess what? You get to do it. I'm so sorry. It's required. California is reminding you, Cal OSHA is reminding you, you need to do this. It was a requirement from November that you need to do. There is a template that they sent us. I can't remember how many pages. It's a pretty long template that you can use as your guide. I think some of the things within the template may not be applicable any longer, but you could use it as a guide if you wanted to follow that to set up your prevention plan. The really important thing in the second sentence, it talks about providing effective training and instructing your employees on what your prevention plan is. And I think this is pretty general. Anytime you do some changes in your hospital, you need to tell your team. Well, here, Cal OSHA is saying you have to tell your team. You need to make sure that they know what's going on and they know what your prevention plan is. I highly recommend you have them sign a document that they read the information that you've given them, because that helps you, it saves you, covers you, and it helps them as well. If the outbreak notification to public health did not change, so you still have to provide notification to public health departments of outbreaks if they happen. You also still need to notify your employees if there is any exposure and or outbreaks, just like you would have done before. And hopefully you weren't blabbing about who got what, but it is really important that you keep someone's COVID status confidential. Now, I understand if you have a hospital of 11 people and one person's out sick for 10 days, it's going to be obvious that they have COVID most likely. But you as the owner or the manager, the leader in your practice, you should not be the one telling your team that this individual and naming them by name has COVID. You have to tell them somebody has COVID, and they can obviously do deductive reasoning and figure out who it is, but you don't want to be the person that says something, okay? Just to really let you guys know that. You are still required to offer testing after potential exposure if they were exposed from someone within the workplace. So if they got it from their grandmother, you don't have to offer them testing. You can if you wanted to, but you're not required. But if one employee is exposed from another employee, then you need to offer the free testing. And it isn't necessarily free testing for you, it's going to be free testing for them, or you reimburse them if they pay for it. So the other requirements for responding to COVID-19 cases and outbreaks are still the same. You still have to do the public health, your workers' comp, you still have to do all those things. And the quarantine and exclusion pay requirements. So those changed a little bit. For those of you who have more than 25 employees, you're still required to pay them the FFCRA leave, the paid supplemental leave from the state of California. They made a separate rule from the federal government. You are still required to pay that. I am not going to go into detail on this presentation because that's an hour-long presentation in itself. So we're not going to talk about that today, but just know that you are still required to pay that. I will have a link on a law firm that I found some information on that was pretty good. I will include that in my email to you guys when I send you the other links, so you'll be able to look that up. And the last one is about housing and transportation, so we're not going to talk about that. Okay. So are all the physical distancing requirements from the Emergency Temporary Standard, ETS, are they gone? And so I think this is where we're going to get a little bit confused. So CDPH says yes, all social distancing is gone. It's not required anymore, right? Cal OSHA has some exceptions. So I highlighted that. So nothing in the revised ETS prevents employers from implementing additional protective measures than are required, including the use of physical distancing and barriers. So if you already put up a bunch of sneeze guards, you can leave them up. If you didn't put up sneeze guards, but you still want to, you can, because there's no rules within the ETS that say you can't, okay? So I want to really clarify that. If you still want to have your client social distancing in your lobby because you feel like your lobby isn't big enough, you can still do that. There's nothing telling you you can't. It's just not required. But the second highlighted sentence, this is where it's fun. Employers are under an ongoing requirement to assess workplace hazards and implement controls to prevent transmission of disease. So there may be circumstances in which employers determine that physical distancing is necessary in their workplace. So if you have that small lobby, if you have the smaller exam rooms, if you want to have barriers and social distancing, you can. There's no rules that say you can't, but the OSHA rule here says you actually have to assess your workplace for hazards to your team. And if you have those hazards, you may have to put those things into place. Now, I'm going to guess a lot of us already have those things into place because we've been doing them for the last year. But if you're thinking about having clients within your building again, this is where that is something to think about, because they're going to tell you, no, there's no social distancing, there's no barrier requirements. But this sentence right here from Cal OSHA says you're still required to do something if it's going to be a workplace hazard. If you have some unvaccinated employees and you have a small space, you might have to think about doing something different. Okay, this sentence clearly tells you that you're required to think about it. You have to assess that. You're not required to do it if your lobby is big enough or if your spacing is big enough, if all your team is vaccinated, you're not as worried about it. You're not required to, but you have to evaluate whether or not it's a danger. Okay, so I do want to clarify that. And then they talk about during an outbreak of 3 or more, the employers are required to evaluate whether physical distancing or barriers are necessary. If you have an outbreak of 20 or more, which is a major outbreak, you are required to use physical distancing and also masks as well. We're going to talk about that in just a moment, regardless of the vaccine status. So again, so really look at your outbreaks of 3 or more, major outbreaks 20 or more. Those are the key things to think about. That's the key numbers to think about, okay? All right. So I mentioned that you're required to use respirators. Now, when I first read that, I had a very different visual of what I thought the respirator was. So I actually had to really research this to determine what Cal OSHA was talking about. So what is an employer's obligation to provide respirators? And again, this is copied and pasted from Cal OSHA. An employer must provide respirators in 2 scenarios: to any unvaccinated employee who works with others indoors or in a vehicle and who requests one, or where there is a major outbreak, so more than 20 people, to any employees in the exposed group for voluntary use. The respirator must be the right size. The employee must receive basic instruction on how to seal it, okay? So what is a respirator? So it's the N95 respirator mask. It's not the rubber mask. That's not the requirement. That's what I thought it was at first. I really had to read this to figure out that, it's not. It's the N95 respirator mask that is what's required for the employer to provide. So what does it mean to provide respirators upon request? An employer must be able to provide the respirator on request, right? Pretty simple. So initially, you can either stock up a bunch of them, you can talk to your team members and figure out how many people are going to want to wear the respirator or the mask, the N95 mask, how many people want it, order accordingly to them, and kind of use that as your guide for how many to keep in stock. It is required that you provide it to them if they ask. You can't get away with, oh, we don't have any. That's not going to work because it is clearly outlined in the Cal OSHA protocols that you have to give it to your employees if they ask. And then in a major outbreak, you have to offer it regardless. So the last highlight thing that I did here is also, I'll read it to you, is an employer is under a continuing obligation to provide respirators to any eligible unvaccinated employees at any time they communicate to the employer their desire to wear one. So if your unvaccinated employee comes to you and says, I want to wear an N95 mask, you need to provide one for them. Now, if they decide to buy their own, they can, but you have to reimburse them. And they talk about that in the next slide. So be really aware of the N95 mask. Previously, Orange County had different rules. I know I'm in LA County, so we had very specific rules. We could either wear a N95 mask or a surgical mask. We talked about the face shield. We had to wear those as well. In Orange County, they didn't have that same rule. You could wear a cloth mask. It's different. This is very clearly telling you that in purposes of, if an employee asks for an N95 mask, they need to get one. Now, it doesn't say they have to wear that mask if they wanted to wear another one. It tells you you have to provide it if they ask, okay? So I just want to clarify that. So more respirator talk. How soon does the respirator need to be provided after an employee requests it? Really, as soon as possible. And you're not going to be able to tell them, oh, sorry, we don't have any. Cal OSHA has a link, which you guys will receive from me as well, of where you can order N95 masks from. It says that they're not going to cite employers who make a good faith estimate and offer to provide respirators. And if you run out, you order them and you have them coming, they're not going to cite you. But if you say, no, I'm sorry, I don't want to give you a mask, or sorry, we're out, and you don't order any and you don't try to get any in for months, then you absolutely could get cited. So just be aware of that. If you're making a good faith effort, they won't cite you, but if you're not, they might. So, and then like I said, you will get the links of where you can purchase your N95 masks if you don't already have some. I know a lot of hospitals who do have some. Okay, so this is a big question. Why is Cal OSHA requiring respirators to be offered to unvaccinated persons? Is this different, or isn't this different from the CDC and the federal OSHA guidance? Now, remember, Cal OSHA guidance is most of the time going to be stricter than federal OSHA, and wherever you are, whatever state, city, county, the most restrictive is what you have to follow. So it doesn't matter what the CDC says or what regular OSHA says. If Cal OSHA says something different, you have to listen to Cal. They're more strict than the other entities, okay? So just to let you know. So they said under CDC and federal OSHA guidance, unvaccinated persons are to wear face coverings and physically distance indoors. But Cal OSHA, and this one's a little bit different because they're actually not as strict, but Cal OSHA is requiring voluntary respirators because California is phasing out physical distancing because well-fitting respirators they reduce infection better. So they're doing a little bit differently than the regular OSHA because of the social distancing requirement that we don't have any longer. And because we can get the respirators more easily than we could last year, because I know last year it was almost impossible to get an N95 mask. So I could get some really cheapy ones that may or may not have worked, but I couldn't get real ones for a long time. So I totally understand that. So just to clarify, that's the difference. So you need to follow Cal OSHA's guidance on that. And then how often must they provide their employee with a new respirator? It's going to be, I think, as they get dirty or damaged, I think that they're not reusable, so I think on here, it's like after it's been taken off and on 5 times. I have no idea how you measure that. You'd have to talk to your employees about how you measure the 5 times because I don't know. That's interesting. So, but that's their rule after 5 times. And who has to wear face coverings? So this is to clarify. We already talked about what California Public Health Department said about the face coverings, which is any unvaccinated people. Cal OSHA says the same thing, but it's different. So face coverings are required indoors and in vehicles for unvaccinated employees. They're not required for employees who are vaccinated, except for the situations that we already talked about, right? So let's go down to the bottom paragraph. Though face coverings are not required outdoors, employers must communicate to workers that face coverings are recommended for unvaccinated persons outdoors within 6 feet of physical distancing. Again, this is going to be your kennel area, your yard, wherever you take your dogs to use the bathroom. If you have multiple people out there, they're going to need to know these things. Employers must provide face coverings to unvaccinated persons and make them available to vaccinated persons upon request. So you can't say, my team, all but one person have gotten vaccinated. I'm not going to provide a mask for that person. It's up to them now. You can't say that. It is your job as an employer to provide your employees with those N95 respirator masks if they ask for one. And if they're unvaccinated, they still need to wear the mask regardless of what your decision was for the rest of your team, okay? So are there exceptions to wearing face coverings indoors? So yes, and this will be kind of the guidance that we've been following for the past year. But this will be more specific for unvaccinated people. is if they're alone in a room, if they're eating and drinking, they're at break, if they're they have an accommodation requirement because of an illness or something, or when the job duties make it a hazard, which we kind of talked about a little bit ago. And you cannot retaliate against your team for wanting to wear a mask. And you can't retaliate against them for not wanting to get vaccinated, which we're going to talk about in just a moment. So it's really important. You can decide to not require your vaccinated employees to wear a mask if they don't want to, if you don't want them to. Now, if you want them to wear a mask, regardless of vaccine status, that's up to you. There's no rules that you can't require them to wear a mask, even when they're vaccinated, if that's the rule for the hospital. You can't have different rules for different people. You can make it a rule, or you can take that rule away. It's totally up to you on that end. You have to think about the safety of your practice. You have to think about your lobby, your physical distancing. We talked about the other thing. You have to evaluate those hazards. You know, you have to kind of look at a lot of things of what you're going to do when you make those decisions. Okay, so vaccine documentation. I mentioned you don't have to require your employees to wear masks, but your vaccinated employees to wear a mask. If you choose to not require them to wear a mask and they're vaccinated, the ways you can document it, the way they recommend that you can document this, because you do have to document it in some fashion. So they say you can get proof of vaccine, so get their vaccine card, a picture of their vaccine card, maybe like a email from their health, like Kaiser or something that says they're vaccinated, and then you have a copy of that. You can make a copy of it, keep it in their personnel file. Or you can also just ask them for proof. So you can say, hey, can you show me your card? You write down this, you don't write down necessarily the details, but you write down, okay, their second vaccine, their vaccine dates or something. Now you know they're fully vaccinated, and then you keep a record of that in their employee file. Or you don't have to, and you can just ask them to tell you that they've been vaccinated. It's up to you and how you want to do it. Personally, at one of my practices, we decided to take away the mask rule. That's a very small hospital. We only have 6 people. And 3/4 of the team had been vaccinated. So we took away the mask requirement for the vaccinated employees. And they all showed me their cards, which I knew that they had been vaccinated because it's a small practice and I go there once a week. So I knew what their statuses were because they would tell me. So I just looked at it. I emailed all the information to the practice owner, so she has a record of who was vaccinated and the dates, so she can put it in their personnel files. I did not make a copy because I figured I didn't need one. I could see it and I can record it. So however you want to do that is totally up to you. I recommend that if you're going in the future to take away the mask requirement, whether you do that now or you do that in the future, I recommend that you get the information for the vaccines now so that it's done, so that you have a record of it, that you already did it. You don't have to worry about trying to collect it then at that time, but it is required that you document it, okay? Now, nothing in the revised ETS prevents an employer from requiring all employees to wear a face mask instead of having a documentation process. So that can be your rule. There's nothing that prevents you from doing that. Now, this last section, what if an employee declines to state their vaccine status? So I'm going to read this paragraph to you. Under the ETS, an employer is not obligated to require employees to submit proof of being fully vaccinated. And absent such a requirement, an employee has the right to decline to state if they're vaccinated or not. In that case, the employer must treat the employee as unvaccinated and must not take disciplinary or discriminatory action against that employee. So if they don't want to tell you, they don't have to, but they will have to wear a mask. You're going to treat them as an unvaccinated employee at that point, okay? So I just want you to know, can't hassle them about it. You just say, okay, then you still wear a mask and then be done with it, okay? So there are some changes on the testing. So Cal OSHA requirements for testing, and this would be for workers within, if they contracted COVID within the workplace. So they must offer testing at no cost to employees during paid time if you have a symptomatic unvaccinated employee, regardless if they know they have an exposure or not. This is a new requirement. So previously, if you had an employee, because when we didn't have vaccines previously, you had one employee that had COVID or they were symptomatic, but you didn't know if they had COVID or not, you know, you would send them to get tested. But here, like maybe if they got it at the workplace, you're going to send them to get tested, even if they don't know if they were exposed. Previously, it was what they were exposed. This is if you don't know if they were exposed to COVID or not, but they have all the symptoms of COVID, you need to offer them to get tested, okay? So just to really clarify that this is a new requirement, it was not previous. So I know there might be some questions because I said it kind of weird, but I'll just read it again. Symptomatic unvaccinated employees, regardless of whether there is a known exposure, must be offered to be sent for testing. It's not required that you send them, but it's offered. Unvaccinated employees after an exposure, a known exposure, then if you know that they got COVID potentially from the workplace or exposed, regardless of symptoms at that moment, you should send them. And then vaccinated employees, if after an exposure, they develop symptoms. I do know one hospital who had a vaccinated employee who was exposed to COVID at her personal time. It wasn't anything to do with work. And she actually started to develop symptoms. They were very minor, but she did start to develop symptoms. So had she developed symptoms at her workplace, then you would have offered to send her for testing, even though she was vaccinated, because she showed symptoms. And then any unvaccinated employees during an outbreak, and then all employees during a major outbreak. So unvaccinated during an outbreak of just 3 or more, all employees in a major outbreak, which is 20 or more. Okay. I know, Cal OSHA is a lot. Okay, so how will Cal OSHA ensure employees are adequately protected if there's a surge in COVID cases? We'll try to get through this. This is basically, they're gonna do stuff on their end. I know we're getting close to being done, so I wanna make sure we have time to do the rest. If you have to leave, just so you guys all know, if you have to leave at a certain time, you're welcome to go ahead and go. This is going to be uploaded to my YouTube channel within the next couple of days, so you'll be able to rewatch it. If you have to leave, I totally understand. You'll be able to see the whole thing, and I will email you all the information, okay? So big question is Cal OSHA going to cite employers who do not implement all the provisions from June 17th's emergency temporary standards? Yes, they will. Are they going to do it today? Probably not. So if you're trying to implement things, you have some time. But should you start working on it? Yes, you should. You should start implementing the things that they've talked about if you haven't already, or if you didn't do anything before, or if you did minimal things before. If you don't implement it eventually, you will get in trouble, okay? So I want you guys to understand that there will be some consequences to you eventually. And most Cal OSHA complaints come from within. They're usually complaint driven. So it's going to be that disgruntled employee or someone who's upset who doesn't like how you've done things. So gosh, get on this, make sure you do this. This is really important. And I will email you the link so that you can do this. Okay, so Linda, are there any questions regarding the Cal OSHA? I know there's a lot of information and I'm so sorry because it's super overwhelming and tedious.
There's a couple questions. Let me go with a quick one. It's, are you going to be including the COVID-19 prevention program template link with the rest of the links that you're going to send to everyone?
Yes, I will include the one from November. I don't know if they have another one yet. If they have a more updated one, I will send that one too, but I will send you the template from November because I've actually had to write that for a couple of hospitals. It's a fun, so it's really fun. So yes, I'll send it to you.
Another question is, the background is we have one unvaccinated RBT due to medical issues, and I was planning to keep her out of exam rooms once we reopen. Based on these new laws, it sounds like maybe I can give her an N95 and allow her into rooms if she wants to go in. What are your thoughts on that?
I think that's a good idea, and I liked how you said if she wants to go in. If her comfort level is she's okay with it, then I would use that as your guidance. Me personally, I do believe in working with your employees to see what they're comfortable with, especially when it's something medical. So yeah, I would absolutely do the N95 mask, and then I would assess. I would also assess the close proximity. If you're going to have clients that are wearing masks or not wearing masks, I would kind of use those as your guide as well to make that decision.
Okay, and then the last two I'm going to put together. So what if an employee declines to get tested if calling out sick and have symptoms of COVID? And then on the other side of that, if we have some unvaccinated employees, if they refuse to work with clients in the building, what is our responsibility? Do we have a responsibility to accommodate them?
So the first question is this a, I'm sorry, I didn't catch, is that a vaccinated employee or unvaccinated who's sick with COVID?
What did I say? Let me go back. What if an employee declines to get tested if calling out sick and have symptoms of COVID? It doesn't say whether they're vaccinated or unvaccinated.
Okay. Well, that would make a difference too, because if they're vaccinated or unvaccinated, the other thing you'd want to know is, was there any exposure from your practice? You would need to know that as far as whether or not you have to test anybody else. You know, I think that the clear thing is to know if you're going to have to test other team members. Where do they get the exposure? Finding that out is another thing. if they're sick with symptoms. So I think it really depends on whether they're vaccinated or unvaccinated, because unvaccinated is different. The requirements are different than vaccinated employees. So I think that I would need to know more about that. Whoever asked that question, if you'd like to email me at southcoastvetsolutions@gmail.com, I can digest that a little bit more with you and ask more specific questions. I don't have enough information. And then what was the second question? Oh, examiners, right? Or clients.
If we have an unvaccinated employee, if they refuse to work with the clients when we reopen, what is our obligation and accommodations to them?
You have to accommodate, unfortunately, the way it's written. I don't mean unfortunately, because I do believe in supporting employees. I don't mean unfortunately in that sense, but it's hard for the employer, and I understand that because I'm an employer and an employee and a person. So I get all of those things. So I think that you definitely would want to talk with your employees about what their concern is about clients coming in the building. Is it because of COVID, or is it because they don't want clients in the building? Because sometimes that they got used to not having them, and there's a little bit of a disconnect there. So I would find out what their comfort level is. I would also find out, if you had your clients wearing masks, does that make them feel more comfortable? If you were verifying vaccine status, does that make them feel more comfortable? What barriers and protective things that can you provide to help them feel more comfortable? So I would get down to the nitty-gritty of those things. I wouldn't just make a blanket rule one way or the other. I'd talk to them first and determine what the real feelings are, what the hazards are, what you can do to help them with those hazards based on what Cal OSHA tells you.
And then the last one is it enough for them? I assume employees, is it enough for employees to just tell you they were vaccinated for vaccine verification? I'd like to think that employees would be honest, but if we were required to show proof that they were fully vaccinated, would their word be enough for Cal OSHA?
So Cal OSHA only requires that you document. They don't require how you find out. So they gave some examples of how you can do it. You can make a copy of their vaccine information, right? Their record, whatever that is. You can look at their copy and then write it down and put it in their file. Or you can just have them verbally verify that they've done it. Personally, I would do it the same for every employee, whatever decision you made. At my practice, I was literally in that practice last Friday, right after the changes were made. So we decided to make changes since we had such a small team. So I just looked at all of the two people that had their COVID cards, and I wrote down the dates and emailed it to the practice owner so she has a record. So however you want to do it is totally up to you. You're only required to document it. The way you do it is not required. Personally, I'd want to see something, but I wouldn't make a copy of their personal record. That's just me. So you can do it however you want. Make a copy, just look at it, or just take their verbal, whatever you feel comfortable with. Just make sure you do it the same for every single person. Okay, we good? All right. So next section. I know that we're going to probably run into the 11 o'clock hour. So again, if you have to leave, I totally understand. I'm going to upload all of this to my YouTube channel. I'm going to send all of you the documentation. So it's totally fine. But for those of you who can hang on, we probably have another 10 to 15 minutes worth of discussion on it. Now, what are veterinary hospitals doing? All right, so I'm not going to read the whole CVMA statement. I'm just going to read that little highlighted sections where it says veterinary practices do not fall within the designation of being considered a healthcare setting or healthcare worker when it comes to COVID restrictions. And they may operate under Cal OSHA's newly modified standards. So if you guys were confused about that, I was very confused about that last week. I've learned more now. It feels like last week was like 2 years ago, but no. So you're not required to follow the healthcare worker guidelines. You follow the business guidelines. And then I highlighted this other part from their statement. It says, while many practices chose to transition into parking lot drop-off model rather than having clients come indoors, it is important to note that this was an individual practice by practice choice rather than a legal requirement. So if you guys told anybody you were legally required, you weren't. It was your decision to do it because maybe you needed to accommodate the COVID restrictions that we had last year, right? But that situation has not changed, and practices remain free to choose the method of client interaction, whether it's curbside services or entry onto the practice premise that practice deems most desirable and effective. So it is still your choice, okay? All right, so almost to the point where you guys are going to share with me. So what are veterinary hospitals doing? So I did write an article on like 6 things I thought about that people should think about if they're going to reopen. And so I will include that link to my article when I email you guys the information, because I wanted you to think about specific things. And VCA, I just got verification from one of the managers at VCA that they are requiring clients. And oh, I didn't change this. They're actually not requiring clients to wear masks anymore. I'm so sorry. This is actually wrong. They were requiring clients and employees to wear masks as of Saturday, but yesterday I got a text from the manager that they are no longer requiring clients to wear masks. I don't know if individual VCAs have a choice to do things different or if it's a VCA blanket rule, but I know that's what Hearst Hospital is going to be doing. So VCA is not requiring clients to wear masks, just their employees. Banfield is requiring both. So they'll be requiring both clients and employees to wear masks still. So I did have another manager, I think she's actually on this, I think I saw her name signing in. So Rebecca sent me a picture of what one hospital is doing, and I thought it was kind of cute. Now they're not in California, but it says, be cool. And it has like a little drawing, which I can't really see, but it says, wear a mask unless you're fully vaccinated. So they made a fun little sign. So, all right. So now we're going to do something where all of you can tell me what you guys are currently doing and everybody's going to be able to see. So I'm going to go ahead. So if you want to get out your cell phones, you can also use your computer if it's easier. You're going to sign into a separate window so that you can do this. So let me go ahead. It's easier if you do it on your, where did it go? Hang on. All right, we're just going to go ahead and go here. All right, it's easier if you do it on your, hang on a second, here we go. All right, so are you looking at my presentation now, Linda? Or I'm sorry, is it on Menti? Or what is it on?
Yes.
Going to Menti, okay. So you guys pull up your phones and I'm going to read you, I don't know if you'll be able to see it, but it says, so go to menti.com and type in the code 3374693. And my first question to all of you is, are you allowing clients inside your building or are you still curbside? Are you doing a hybrid version? So menti.com, there we go. And use the code 3374693. All right, awesome. So everyone that types it in, you guys are going to read it. I'm going to send all of you a copy of this so you don't have to take a picture of it or screenshot or whatever. So it looks like we've got a lot of hybrids. We're moving to hybrid on August 1st, curbside till then. We're allowing clients inside, curbside, hybrid. Curbside, we're open. Hybrid started last week. And I will scroll down. Hybrid, currently curbside, but hybrid. Clients in building with masks, curbside an option, hybrid very slowly. Hybrid, letting clients in to see doctors, tech appointments, still curbside, payments over the phone, only for euthanasia with masks. Hybrid, various, allowing clients if they ask. Wait a couple other moments. Okay, we're still doing curbside, hybrid in certain situations. So we've got a lot of hybrid and curbside people. There's a few people that are letting people in the building. I know the changes were just made like a week ago, and I know how veterinary hospitals operate, so it'll be a bit. Curbside, hybrid, minimal appointments, hybrid. So we've got a lot of hybrid. If there's anything in the chat, Linda, that's adding to that, you're welcome to shout it out if they can't get into Menti.
We do have a question for those who've recently moved to hybrid and open. What pain points have they noted to help the rest of us prepare for reopening?
That's a great, so for those of you who have opened like that, please put your comments in the chat so that we can read those in just a minute, okay? Because I didn't actually ask that in my questions. So please type that in the chat. So Linda, you want to read the question one more time and then you can respond?
For those who've recently moved to hybrid or open, what pain points have they noted to help the rest of us, in order to help the rest of us prepare for reopening? What's your pain points?
Awesome, thank you. Okay, so we're gonna go on to the next question. I don't think we had anything else. Oh, someone said curbside till July. Where it happened? There we go. Okay, is your hospital currently requiring vaccinated employees to wear masks? That's my next question for Menti. Is your hospital currently requiring vaccinated employees to wear masks? Use the code 33746393. Yes, no, yes, yes. We require everyone to wear masks. I'll wear masks still. Yes, yes. Masks are optional. Within a room with the clients. Yes, yes. No, just took our masks off yesterday for vaccinated staff. Yes, 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 yes. I'll have to. So it seems like a lot of hospitals are still wearing masks. I know the rules just changed, so I know that's fast. Okay. All right. Oh, yes, we still have to wear them. Oh, mask optional with clients in office. Yes, not since yesterday. Good. Okay. Wait another couple seconds, then we'll move on to the next. Okay. Do you plan on changing this by July 1st, or do you have a different date? So do you plan on allowing your client, or I'm sorry, your employees, vaccinated employees, to take off their masks by July 1st, or do you have a different date in mind? So again, menti.com, 3374-6393. Yes, as of today. Yay, I love that exclamation point. I was so happy when we got to take off our mask. No, do not plan changing anytime soon. No, overly cautious. We have 2 pregnant women, I understand. No, we have a different date, but today we may have to, after today, we have to rethink. Not necessarily, we're monitoring the numbers still. No, possible August, no solid date. Probably many of them are asking, spec will allow that. No, we don't have a date yet. All will still wear a mask, and employee and clients per employee request undecided. Unsure, keeping an eye on potential surges. We are VCA. I understand that. I understand when you work for a corporation, you don't necessarily get to make that decision. So I completely understand. What is a mask? We are unsure. No solid date, possibly. Okay, so I wanted you guys to be thinking about this. So I appreciate, I'm gonna go ahead and type that. All right, so we are a small, fully vaccinated hospital. Employees who want to wear will still, who want to still will. And I think that's true. So if you decide, like we decided in this one practice I was at last week, we decided it was okay to take off the mask for the vaccinated employees, but one of them said, I'm still gonna wear my mask. And I said, no problem, go for it. Like, that's totally within your right. So if you do decide to take off your mask, as I mentioned, you can't tell them not to, I would just tell them to do it if it makes them feel more comfortable. Honestly, they're your employees, their comfort means a lot. So yeah, absolutely allow them to if they want to. Okay, and then what about, is your hospital requiring clients, vaccinated clients, to wear masks? Are you asking clients for proof or just a sign on the door if you're not requiring them to? So I'd like to know now, is your hospital currently requiring vaccinated clients to wear masks? Are you asking them for proof or just a sign on the door if you're not requiring them to wear a mask? Yes, not asking for proof. Yes, in the exam rooms, making everyone mask when you approach them outside. We asked all clients to wear masks at the time. We've been requiring masks and have been asking them to provide proof. I'd love to know how that's going. Whoever put that, love to put in the chat how people are responding to proof. Yes, all clients wear masks. All clients masks, unsure. Yes, wear mask. Looks like a lot of people are still wearing masks, except for this one says, okay. Most people are saying yes. They're still requiring it. No. Yep. So someone says today, 6/23, new signage is going up that states if they're vaccinated, they don't have to wear a mask. We're not asking for proof. Everyone's wearing a mask. So only one person, I think, said that they were asking for proof. So if you don't mind, and put in the chat, when we get to the end, we'll respond to it, how that's been going for you. I have a friend in Texas who has been asking their clients to wear masks for a while, and they've been mask free in Texas for a couple months as far as the legal mandates, and their hospital's been asking. So, and she says it's been all right, but Californians are different, so I don't know how that'll go. All right, next question. Do you plan on making any changes to this by July 1st, or do you have a different date? So this is clients wearing masks. Do you know if you're going to change that at all by July 1st, or do you have a different date in mind, or you don't have a plan yet? One thing I want you guys to think about, all these rules you can decide, right? The business still has a lot of power, but just be aware, I want you guys to think about it, is that the longer we go without the mask mandates from the state, the harder it might be for some people to continue to want to put it on to go into your hospital, or they might still be very comfortable with it. So I just want you guys to have thought about that. And who's the person who has to tell them to wear the mask? It's just, who's that person, right? Okay, so no date yet, no known date, no end in sight, no pregnant ladies, or because the pregnant ladies, they have to wait till the regional director decide, I get that. Maybe August, maybe July 12th, okay. So I do think you guys need to, whether you're a veterinarian, practice owner, or practice manager, you need to sit down and have a conversation with your leadership team if you haven't already, and go over facts, go over figures, go over what the rules are, go over what other hospitals are doing, and kind of come to a decision. I do think there has to be an end date, right? So you want to sit down and think about what you're comfortable with and making that with your hospital's best interest in mind, as well as your employees, as well as your clients, okay? So I like it. Taking it day by day, comfort of staff is necessary. I 100% agree. The comfort of staff is definitely necessary, as well as your clients. And judging what I've seen, a lot of people are still wearing masks inside buildings, whether they're vaccinated or not. So I do think that there's a comfort level there. Okay. Oh, sorry. How have you communicated your plans to your clients? How did you do that? So did you tell your clients what you're doing? Any changes you're going to be making? Did you email them? Did you put it on social media? What did you let them know? So I'd like to know, have you talked to your clients about what you're doing and how you did that? And so thementi.com 3374-6393. Email blasts and social media, great signs on the door and verbal. Email messaging through text messaging, I love that. We've only told those who asked, there is no change. Email blast. So it looks like a lot of people are doing signage on the door, email blast, and text messages. I love it that a lot of people are doing this, you guys. This has been a great year for technology for veterinary hospitals, so it's awesome. We updated external signage to reflect any changes. We give them heads up when we make an appointment, working out the kinks. Everything's a kink, right? All changes are kinks, so that's awesome. Signage and email blast, looks like a lot of emails, and then getting ready to do. Laugh out loud, not working any notifications, still have the most current guidelines. Trust me, whoever put that, I totally feel your pain. There's changes so fast, but I think, cross your fingers, there may not be as many changes as there was over the past year. So we'll cross your fingers for that. So you can do your draft of what you're gonna do. All right, so put signs outside. Okay, awesome. So thank you guys for that. There we go. So my last question, based on what you've learned today, are you gonna do anything different than maybe you planned? Or are you going to come up with a plan that maybe you haven't done yet because you hadn't thought about it or you hadn't had all the rules and things? So now that we've talked about a lot of these different rules, and I'm going to send you a lot of links and things, are you going to do anything different? It's okay if you're not. So whoever said no, that's totally fine. Some people don't need to because maybe they're already doing exactly what they want to do. But did you learn anything different? Yeah, I totally understand the corporate thing. I didn't get all the corporation information. I just got the big ones. Continue your plan at a quicker rate. Well, solidified plan based on this. Thank you. Yep, it's definitely not new. It's just reading all the information was such pain. And I want you guys to understand too, I'm not giving you direction on one way or the other, whether you should let clients in your building, whether you should have clients take off their masks, or whether you should have employees take off your masks. I want you guys to have really just a good educated decision for what you want to do at your practice. I don't want to tell you what to do one way or the other. I just want to make sure you've thought about everything. Good. Move the hospital out of California to get away from Cal OSHA. That's awesome. You practice and discuss. Good. I think you should definitely discuss it. I love that. Communication is key. All right. Wonderful. Thank you. So I'm going to go back to my presentation. Okay. All right. So here's the links to the references. Like I said, I'm going to email them to you, so you don't have to take a picture. You can if you want to. You totally can do whatever, but I will email this information to you so you'll have it. If you registered for the event, I should clarify, if you just got a link from someone else, I don't have your email. You'll need to email me at southcoastvetsolutions@gmail.com, and then I can send you the information. If for some reason you were shared this link from someone else, I don't have you registered, then you can email me and I can send you the information. All right, so what questions do we have? Do we have any other questions besides what someone's pain points? They asked about the pain points. I want to answer any questions first, and then we'll talk about the pain points of reopening.
Let's see, if we allow clients and vaccinated staff to go maskless, how do we avoid the stigma that will follow those employees who decline getting vaccinated? Will it be fair?
I understand that, and I struggle with that with myself, with people feeling like they were being bullied one way or the other. I think that you can have a very open conversation. You can make even cute signage that says, you know, if you're vaccinated, feel free to take off your mask, but you don't have to. You can keep your mask on if you feel more comfortable, so that if people are still wearing their masks, it's not assumed. I'm going to tell you right now, when I went into the grocery store and 90% of the people are still wearing masks, I'm not assuming anything one way or the other. So I think it's a good thing that you can put up some notifications that just say, please wear your mask if you're comfortable, whatever. So make some kind of acknowledgement visually so that people feel that they're okay with it, and have an open dialogue with your team and tell them, don't be mean to people one way or the other. If they still want to wear their mask, they can. If they have to wear their mask because they're unvaccinated, don't make a thing about it.
It looks like that, unless I've missed somebody's question, I think that's it. We do talk about the pain points, and it looks like it's basically clients who don't want to wear masks, or they come in not seeing the big stop sign that's there, so they just walk on in without their mask. And how should you handle that, or what's the protocol for that?
I think that which I know that not everybody who comes into your building calls you. I know sometimes they're picking up meds, or they're picking up food, or they're picking up something, or they're a different party than who made the appointment. I do think that, and no matter what, we can do as much as we can to communicate to people, and they don't always listen. But I think that making sure that in your appointment that you're verbally telling them over the phone what the rules are, right? In your text message confirmations for the appointments, when you confirm if it's just a verbal confirmation, when you send them an email, when you send them information. I think that there is not too many places, like you can't have enough places where you're communicating them what the rules are, so that if they were the one who made the appointment, they can't have just forgotten. So I would say that verbal communication ahead of time, and then putting the sign in places that it's a little bit more obvious, which sometimes it doesn't matter. They could move the sign out of their way to come into the hospital and they didn't even read it. So I do think that those things are a challenge, and that's where you have to talk to your team about what they're comfortable, how they're comfortable saying. Have a freaking phrase that everybody memorizes of what the requirements are. You can have a box of masks. You're not required to give your clients N95 masks, just your employees. So you can have a box of surgical masks with a big sign that says, hey, if you're not wearing your mask, please grab one, if that's your role. So try to hit them in so many different ways to talk to them about what your requirements are.
And then Sandy wins the best comment of the day, saying that their biggest pain point is getting their doctors to dress the part again. Way too casual and unprofessional, and they have not had to FaceTime with clients for 18 months. And then someone else commented that a relief vet is the same.
If you haven't seen, and I cannot remember the name of the hospital, I will email you guys the link when I send you this. There's an amazing video from Dr. Bob is the name of the veterinarian, and it says, we're opening in 10 days. Is Dr. Bob going to be ready? And it goes over how he cusses all the time, and so the pain points that they go through. And he buys a lot of free lunches for his team because they made that as a deal. And it's the funniest video, and it's what they did to show their clients about the reopening. And it's amazing. So those things are really funny, I think. So doing something like that too, making a cute video for your clients to see and be aware of, is also really good.
Okay, let's see. Do we have to give our clients, oh no, you answered that, the N95 mask, it's not required to give to your clients?
No, just your employees.
And
that doesn't mean if you have extras, you can. I'm not telling you don't do it. It's not required.
All right, please address the ventilation systems to maximize outdoor air and increase filtration efficiency, and evaluate the use of additional air cleaning systems.
I'm going to send you a link on that because it's in language that I don't understand all of it. So it's in air conditioning speak. But yeah, there is a link very specific from Cal OSHA of what the rules are, what you have to look at for your filtration systems. I'll send you the link to that. So I'm going to send it to everybody so you can read it. I would also maybe talk to your air conditioning company and kind of get some guidance. My one practice that is allowing their employees to take off their masks, they already had a really good ventilation system because they set up to become very solar and efficient and energy efficient and stuff. So they kind of already had a loop. So they didn't have to change anything, which was kind of cool. But the system that they had worked for that. So I'll send you the link so you can actually review it and go over what works for you in your practice.
Did I miss anybody else's question? We do have a comment that some employees have not worked prior to COVID, so they do not know anything but COVID. So it's going to be a learning process, and they'll have to learn how to work with clients.
I know that's going to be a challenge. I think one of the most important things you guys can do is honestly just have a lot of conversation with your employees. Sit down, find out what people are uncomfortable with, what they're comfortable with outside of the rules. They're your team. So their comfort means a lot. I think client comfort means a lot. I do think that we lost a lot of client relationship over this past year. And obviously I want to get that back, but I think it starts with what their feelings are. And I want them to feel heard. And remember, every change is always painstaking. No one likes change. When we went to curbside and masks and all that last year, everybody was irritated about it, right? All these changes. And now we're going back essentially. So it takes time for everyone, and everyone needs to hear that message, what, like 3 to 4 times before they believe it. So you have to have these open dialogues with your team as well as your clients, and even with your ownership and your leadership teams. So I can't express enough how much team communication is going to make a difference for this, being successful or not being successful.
I think that's it, Melissa.
All right, awesome. Well, thank you guys so much for coming. I am going to email all of you who attended. Oh, someone raised their hand. If you want to unmute yourself, Shireen, you're welcome to.
Oh, sorry. I had put a question in the chat. If once we like lift the mask policy at our hospital, if unvaccinated employees, do they have to wear an N95 mask or a regular mask? Sorry, missed that part.
They have to wear what they're comfortable with. So if they ask you for an N95 mask, and I'll clarify, if you're in LA County, we had those N95 surgical mask requirements. I would just continue that. If you're in another county that didn't have requirements specific to what kind of mask you had to wear, I would go with that. However, I would tell your employees, hey, new Cal OSHA laws, if you want to wear an N95 mask, you just have to let us know. I would tell them that. I wouldn't wait. I wouldn't make it a secret. I would be honest with them. But if they don't want to wear the mask and you're not in LA County, I wouldn't make them wear an N95 mask unless they ask. But if you're going to have clients in your building not wearing masks, I would lean towards doing that and making it automatic, because you do have to think of, if one of your employees gets exposed from a client at your practice, it's going to be on your hospital. So I think the answer is you could have them wear whatever mask, but I would probably stick with the N95 mask, because then you can show that you're doing the best you can for the team.
Awesome. Thank you.
You're welcome. Any other questions? If you want to unmute and ask, you can, or if there's anything in the chat, Linda.
It doesn't look like there's anything else. I did misspeak when, let's see, Shireen just asked if they had to wear an N95. I thought it was specifically said N95, but you just clarified that. So yeah. Thank you.
Hey, Melissa, I saw on one, and I can't remember, I think it was on Cal OSHA, that it was like requiring double masking. Is that, did I imagine that?
No,
or
that's something, and let me go back. There's so much information. I got a headache. I don't know. I did see the double mask too. Was it on my screen or was it on something else you read?
It was on something on the Cal OSHA website. I think I saw it last night when I was trying to figure things out.
I know what you're talking about, and it was kind of like, if you want to double mask, if you have an outbreak, major outbreak, those are the people that would consider it. I will find what you're talking about, and I will email that to everyone. Have me write that down so I don't forget, because
it was confusing.
Yeah. Yeah.
Let me see if I can find it.
Okay, so Cal OSHA mask, double mask. I will make sure I acknowledge that, and I'll send that to you guys.
Okay. Thank you.
So for anyone who watches my YouTube channel and doesn't get to have the emails, I'm sorry, because I won't know. I won't be able to tell you. Maybe I can update it in the comments. So yes, so if you any more questions, feel free to shout. Otherwise, please feel free to follow me in social media on both Instagram, Facebook, at South Coast Vet Solutions. You can also follow my YouTube channel, which is South Coast Veterinary Management Solutions. You can like or subscribe. I'm going to start posting a lot of things on there. I have one video so far, and then this will be my second video. So feel free to follow me and email me if you have any questions. I don't know all things California. There's a lot. I just know a fraction. So I'll try to help you get information. I'm really good at knowing what the resources are. So anyway, so thank you guys so much for coming today. I really appreciate your time that you took out to be here with such last minute notice. I hope that I helped you. I hope I didn't overwhelm you. Hopefully that I can see some of you in person again. If anyone's going to the VHMA conference in Philly, I will be there. So I hope to see a lot of you again in person.
Thank you.
Thank you. Pause recording.